Welcome back to another podcast of Heal Without Harm, brought to you by Dr. Clayton Dir, physical therapist, also known as the Doc Dir. Today's podcast is going to be just a solo one. It's just going to be me. I'm going to bring to you information about low back pain. So we're going to call it Low Back Pain 101. This is a topic that is very scary to a lot of people, whether you are the one with the back pain or you are the student physical therapist in school learning about all the different things that could be causing it. I want to demystify a lot of that. I want to make that a lot less scary for you, give you some rough percentages that I see anecdotally in the clinic on what causes it, and how often or not that often we actually see people coming in with big, scary injuries. Just to give you a quick stat, again, this is anecdotal. In my practice, I've been working as a PT for about 4.5 years, and I've seen less than 5 cases of true sciatica with numbness and tingling down the leg, or something coming truly from like a very very obvious disc ultimately. Okay. And so again, this podcast is all about trying to point out the flaws of the medical system, talking to, I should say, the people who are frustrated. They're frustrated that if they do show up at your regular primary care physician with low back pain, they're probably going to give you some muscle relaxers. They're going to give you some anti-inflammatories, send you on your way. Usually the next step, and let me know if this resonates with you, usually the next step after that is taking some sort of an x-ray. That still didn't work. And then they set you up with usually 2 consults, one with a neurosurgeon or like a low back surgeon. And then the second one is a pain management doctor because, hey, you're 40, you got to get used to this now. You're getting older. Go ahead and just stop doing squats, running, fill in the blank, whatever bothers you, and get used to it because this is your life now. At least that's how it feels, right? And so you go to this pain doctor, and they just start giving you injections to try to make the pain go away, even though it's not solving a problem. And then you go to the neurosurgeon, and they're like, yeah, it's you've got some degenerative disc disease, which we'll define that here in a little bit. You might as well get ready for some fusions, essentially surgery in the future. And I wanted to let you know that the majority of the time that is not needed ultimately. And they've even done studies that people do who do go get that surgery. 2 years down the road, they're in the same boat, aka much less back pain or about the same or like not that much significantly different than the people who went and got physical therapy. Usually good results in both. But again, one of them got cut open, got screws and rods in their back. The other person did exercises prescribed by a PT. And so let's break a lot of this down. And so let's start back with, let's say what it looks like to go to physical therapy with back pain and the common tests that I'll do with people, the usual diagnoses we kind of provide, and where this back pain is usually coming from. Now, I do want to let you know that there's a lot of things I can't cover in a 10 to 12 minute podcast. There's a lot of things that are extremely nuanced person to person, so there's going to be generalities here. This is not medical advice. This is me trying to expose you to the fact that you probably don't need imaging. We actually know that the earlier you MRI somebody, the increased medical costs they're probably going to entail, the more likely they're going to have chronic pain. Their pain levels are generally going to be higher because they're starting to medicalize that problem. Again, you don't need an MRI the majority of the time. You don't need to go to the primary care physician the majority of the time. In Kansas, which is really nice, you can actually go directly to a physical therapist for evaluation, and we are much more equipped to evaluate you on this. Physical therapists have the majority of their education in diagnosing musculoskeletal problems, muscle, bone, joint type problems. To my understanding, medical doctors generally don't have that education. They have to know a little bit about absolutely everything. That's a daunting amount of information. Respect to them. But leave these kinds of things to the specialists, physical therapists. It'll be very helpful for the consumer. It'll be very helpful for the PT because then we can make you better much, much quicker. So let's entertain. Oh, the other thing I wanted to point out, I apologize, is this conversation is going to be more about the chronic back pain that you've had for more than 3 to 6 months, not pain that came on because you fell in the ice yesterday. That is still very, very addressable and treatable to a physical therapist or by a physical therapist, but these conversations will be more on that chronic back pain. And so let's say you've had back pain for the last 6 months, 2 years, 10 years. You're just living with it, right? Because your mom and your dad had a, quote, bad back. And you've tried some different things. You don't want to take medications. You don't want to live on ibuprofen. And so you want to really get to the root cause of this. So if you're driving right now, be safe with anything that I suggest you trying or like palpating on yourself in regards of where the location of the pain is. You may also be mowing the grass. You may also be like shoveling the driveway. You may be working out. You may be just walking. as we go through this, if you are someone listening with back pain, I want you to palpate around on your low back, which just means touch your low back ultimately. And really try to identify where is this pain, because a lot of the times people don't identify the right spot very well, or they don't really know where their low back is, where their sacrum is, where their SI joints are, and where their hip muscles are, aka the glutes, the butt cheeks. Most of the time, it's a butt cheek problem. It's a weak glute problem. It just kind of radiates into some different areas, and you assume it's low back pain. Totally understandable. So let's say you book a visit with me or one of my colleagues, a physical therapist. You come in with low back pain. We're going to take a fairly extensive intake paperwork to try to get some good information. And then when you come in, we're going to sit and chat for 10 to 15 minutes to really get down to like, what makes this back pain worse? What makes the back pain better? What can you not do right now? I mean, is it hard to just get on off the toilet, or is it only hard if you're lifting over 100 pounds? We need to know all those pieces of information. After we get through the discussion and really try to understand how this is affecting you, what goals you can't achieve, and how it's changing your daily life, then we move into assessment. Usually we do a trunk test. We see how well do you move forward, backward, rotation, so on and so forth. Then we start getting into like each individual side, and this is where we find most of our problems. Most problems that we see come down to weakness within the butt cheeks, weakness within the glutes. Now, I'm using glutes as a very vague term, because if I count them real quick in my head, on each butt cheek muscle, you have glute, med, min, max. You have 3 there. Then you've got the fourth one, 5, 6, 7, 8, 9, at least 9 muscles within that area. And the majority of them attached to that like bone on the outside of your hip, that one that just feels like a knob. And then you have what's called the iliac crest, this big flared hip bone, kind of on the side of your abs or like your obliques area. You'll feel a bone there. And so whenever these muscles are weak and they're having dysfunction, they can refer pain to any of those bones that I just mentioned. And so let's go ahead and have you, again, if you're driving, drive safe, please. But take one of your hands, and I want you to visualize your back. And some people have like little back dimples, right, where there's like a sulcus where the skin is tacked down. Usually that's right on top of the SI joint. So if you take your hand and you place it back on the SI joint or that back dimple, most people's pain are going to land right about there. You may have pain a little bit higher, a little bit lower, a little bit more out to the side, but the majority of the time it's landing right there. And what they'll do is they'll go and get an X-ray and an MRI, and they'll be like, hey, you've got a disc issue at, pick your level, or you have degenerative disc disease, pick your level. And they'll go treat it, right? They'll get injections in that area. They'll do certain things to the back, and then the pain doesn't change. And if you need any more confirmation that they're doing the treatment, either the wrong treatment or the treatment in the wrong location, that would be it. When you do a thing and you get a result you're not desiring, then it's probably not the thing for you. It's not the treatment for you. So back to palpating on that SI joint. So your thumb is on the SI joint. If you go down and out to the side, so we call it lateral, going out laterally, and you start to really push in, you're probably going to find some tenderness. You're probably going to find some like, ooh, that feels like there's a knot there. That feels angry. That feels irritated. Something along to that tune. Yeah, that's confirmation that that muscle is not happy. And the majority of the time when we go and test the strength of these muscles, less than 10% of the people that I see have strong muscles there. And so just imagine that every single day you're asking these muscles to do their job over and over and over again, but they don't have full capacity. When you ask that to do that, no wonder it's causing pain. No wonder it's causing issues. I want you to imagine like starting a job where you are not fully equipped to do that job and nobody really trains you. They just tell you to keep going, right? You're going to get pretty frustrated, sad, depressed, angry, pissed off. Pick your word here, right? But you're not going to be happy. And that's what these muscles are for you. This is not usually going to be seen on an MRI. This is not going to be seen on an X-ray. It's a functional movement. It's a functional test that's required to see if this muscle is strong. And most of the time it is not. You go strengthen this muscle up with some guidance of a PT, personal trainer, a good chiropractor, whatever it may be. When you identify the issue, you go start strengthening this muscle and you'll notice the back pain starts to go down, or the pseudo back pain, because we've now identified it as more of a glute issue. It's a glute tendinopathy, a glute tendinitis. Now, that SI joint, though, can be challenging sometimes. I'm giving you, like I said, generalities. The SI joint is an intersection. All of your back musculature will attach right around the area. All of your glute and butt cheek musculature will attach close to that area. And then you also have to remember that that is a joint. It's a joint that doesn't move like your finger joints or your elbow or your shoulder. It's really only going to move about 3 millimeters, which is 0.3 centimeters. Very, very little. but all of the weight of your leg, well, not all of it, because it can also go through the front portion of the pelvis. A good portion of the weight of that one leg is going to be transferred through that SI joint. And so there's a lot going on there. There's a lot of forces going on there. Totally normal, should take place. But what I'm saying is most of the time it's a glute and hip strength issue. And then sometimes it's some other things too. But again, most of this doesn't come down to a disc pathology. But that sounds scary. This doesn't. This is like, oh, I've got weak hips. Tell me how I strengthen them. Tell me how we can get pain down and make them function a little bit better. That's usually what low back pain boils down to. Again, there's so much more that could be talked about here, but I want to keep this short. I just want to let you know that most of the time, low back pain comes down to hip strength and, well, lack thereof, ultimately. And so you start to strengthen those glutes. You strengthen the small little stabilizers. Let me be particular. The small little stabilizers, if you want to get fancy with words, it's your hip abductors, like take away abductor, and hip external rotators. These are the small ones underneath the glute medius, the glute minimus, and then what we call the P-go-go-Qs. It's a bunch of like Latin words, but all these little stabilizers, and like imagine your back pocket on your butt. Like think about like the lower portion of that back pocket. That's where those muscles are. And so if we can do some soft tissue work, some dry needling, some different like trigger point release, sometimes it's like a push and it's like a release with our thumb or elbow on those muscles. Then we go teach them how to function a little bit better, get a little bit stronger, teach them how to stabilize the leg. The back pain starts to go away pretty quickly, actually. So I want to go and wrap this up. I wanted to make this one a little bit short. I just want to expose you to some of this information. Again, this was low back pain 101. Most of the time it comes down to hip strength. If you like this information, please subscribe to the podcast. Please leave me a rating and review. And then if you want, you can go check me out on Instagram or TikTok. My name is @thedoctor, THEDOCDIR. Please come out, comment on some of the things, send me a DM, ask me questions. I would love for this to stir up some more conversation so I can give you a little bit more specifics moving forward. Again, today is a more of like a quick snippet, a 101 type class. We will still have client success stories on. We will still have coaches chat, and we'll even start talking to some other medical doctors, naturopathics, chiropractors, other providers as well. If you have any questions, please reach out to me. Other than that, I hope today you learned a little bit more about how to heal without harm. See you guys.